it's often so myopic, it's just about the egg, right? Just about the egg. And we forget that mom is both the seed and the soil. So she has the egg, which then meets sperm, and that should be healthy too. And then there's implantation, right? And following that is gestation, which is growing a baby. And you have to cultivate a healthy soil to have the healthiest baby and the healthiest pregnancy. And so much of fertility focus is like, let's just get you pregnant and let's try to keep you pregnant and not thinking about, but can we optimize that entire journey?
Today, I welcome on the show my guest, Dr. Jolene Brighten. Dr. Brighten is a board-certified naturopathic endocrinologist, clinical sexologist, and prominent leader in women's medicine, a fierce patient advocate and completely dedicated to uncovering the root cause of hormonal imbalances. Dr. Brighten empowers women worldwide to take control of their health and their hormones. She's an international speaker, clinical educator, medical advisor with the tech community, and considered a leading authority of women's health. Her most recent book, Beyond the Pill, walks you through the steps needed to figure out your particular hormone imbalance and offers guidance with her signature protocols to get you back to a healthy cycle quickly. Dr. Jolene Brighten, which is a fertility and hormone expert, obviously for females. And I'm at the Health Optimization Summit, and we're going to talk about fertility and hormones and really how to maximize that to have a healthy baby, most importantly. So the first question I want to ask you is, why a holistic approach to fertility? What can you say about that?
Well, I think that it's often so myopic, it's just about the egg, right? Just about the egg. And we forget that mom is both the seed and the soil. So she has the egg, which then meets sperm, and that should be healthy too. And then there's implantation, right? And following that is gestation, which is growing a baby. And you have to cultivate a healthy soil to have the healthiest baby and the healthiest pregnancy. And so much of fertility focus is like, let's just get you pregnant and let's try to keep you pregnant and not thinking about, but can we optimize that entire journey?
And how do we optimize it? So talking about hormones, like how do we recognize if we're out of balance for a woman that comes to you asking, how do I get my hormones working for me to then proceed and have a baby?
Yeah, well, I think that so often we want to talk about estrogen and progesterone, very, very important in pregnancy. But what gets left out of the conversation is thyroid and what's happening with stress hormones and insulin. So we know that if there's insulin dysregulation, glucose issues, that can actually make it, you can get pregnant, but you may not stay pregnant. And that may also lend itself to developing gestational diabetes, which is going to have a lot of complications in itself during the pregnancy. So when I talk about, cortisol and thyroid, cortisol is a stress hormone. And I like to think about a pyramid. So we've got insulin and cortisol at the bottom, and then we've got thyroid above that. And the tippy top is the sex hormones. Should I pause? Okay. So the sex hormones, they're going to be where we see menstrual cycle symptoms coming up right throughout the cycle. But those can really be influenced by what's going on with the thyroid and what's going on with cortisol. So we've got to have great sleep. We've got to keep stress in check. And then when it comes to fertility in particular, the thyroid is not often screened. It might be screened once you become pregnant, or if you've been struggling for a long time and you meet with a reproductive endocrinologist who's well versed in thyroid. But for a lot of women, suboptimal thyroid function can lend itself to infertility, pregnancy complications. We can see that there can be premature birth, there can be preeclampsia risk that comes along with that. So very much, I'm a proponent of testing the thyroid before you ever get pregnant, and then monitoring that in the first trimester, which will help you determine if you need to monitor it throughout.
Amazing. And so I was going to ask you the certain tests, but you said testing the thyroid.
Well, we can talk about the specific tests.
Yeah, if somebody is preparing to go on a journey of conceiving, when should they begin doing these certain tests, and what certain tests should we be doing?
Well, we want to start preconception like a year in advance, but nobody likes to hear that, especially, I mean, I'm 41. If I want to become pregnant, nobody wants to be like to hear that at my age, to be like, give yourself a year, because you're like, TikTok, like I want to be pregnant now. And so at least 90 days, we want to gather this information and really start supporting the system. The egg is that you ovulate with, it's actually going through a maturation process. And what you're doing a year prior is going to influence that egg. That within the first 90 days, or excuse me, the 90 days prior to conception, that's a really critical window as well. So you can make change there. So we want to test looking at, when it comes to sex hormones, if there's no symptoms and everything's going great, perhaps we don't test those. But when it comes to thyroid, we absolutely want to get a TSH. That's what the brain says to the thyroid gland. A free T4, that's actually what's available and the thyroid produces. A free T3, that's for mama. Okay, baby gets the free T4, that crosses the placenta, and that's everything, especially in that first trimester. But that free T3, that's going to be your energy, your mood, your menses, your metabolism. It's really critical, and it can show us, are there any other issues going on? And then we want to get thyroid antibodies. So anti-TPO is one that most doctors will order. Anti-thyroid globulin is also important to look at. And if those are elevated, we have a high-risk pregnancy. And most people, but most doctors don't realize that. That's a diagnosis of Hashimoto's, which I myself have. And that throws you into that you need to be monitored throughout your pregnancy, your thyroid, and you need to make sure that you're working with a specialist who's going to, if those antibodies stay up, they need to look at baby's thyroid in the third trimester to make sure that baby's thyroid is okay as well. And most diet lifestyle interventions that we use can really help with all of that. So it sounds really scary, but there's a lot that you can do to really optimize all of that.
Yeah, that's what I was going to ask you. What would be your advice for things we could do to optimize our fertility as far as foods or supplements? What would you recommend just off the bat?
Well, how many veggies can we eat?
Yeah,
that's definitely right off the bat.
Yes.
Because those are going to be rich in antioxidants and phytonutrients, and those are very protective of the ovaries. Any kind of antioxidant we want to be bringing in, including melatonin, which means getting good sleep, avoiding light exposure at night. So eating lots of plants, very important. Getting protein in is how we detox our estrogen. It keeps our blood sugar balanced. So what that looks like, some people choose not to eat meat. Some people do choose to eat meat. If you are eating meat, making sure that you can get the best sources possible that are going to be low inflammatory, and that like your beef was grain fed. And making sure that it's, you're getting that grass fed, so you get great omega-3s coming in through that meat as well. And then looking at fish, of course, for omega-3 fatty acids. And fish is actually excellent as a source of iodine and selenium, which is super important for the thyroid. And so, if we're talking about thyroid antibodies, selenium is important. What we see in the research, it really takes supplementation of about 200 micrograms to help put those antibodies in remission. And that selenium is going to be really supportive of fertility as well.
That's so great to know. And so what would you say to women that are, I'm 41 and I still want to have a child. I do have eggs frozen. It's not a complete embryo, but I do have eggs on ice. And what would you say to somebody of, I would even say 38 and older, any advice you would say to help increase that fertility and the chance of having a healthy embryo?
Absolutely. So your environment is everything. That's going to impact your egg quality and the health of your body as well. So if you have eggs frozen, like that's a done deal, right? Those eggs are done. But if you're not in that situation, then bringing in things that are going to support mitochondrial health, again, bringing in antioxidants as well, that's going to be really important. Everybody should be starting a prenatal at least 3 months in advance of becoming pregnant, because we want to build those nutrient stores. And then we also wanted to get testing and do individualized approach to all of that. Now, at home, you can be cutting down your environmental toxins that you get exposed to. That's going to have a tremendous effect. You can make sure that you are eating that nice plant-dense diet so that you are metabolizing your hormones, getting your phytonutrients in, getting great sleep, tending to your stress as well. But meeting with a practitioner who's going to screen you, make sure that your oral health is optimized, your inflammation is low, that your gut health is as best as it can be, And then really taking a deep dive into a hormone questionnaire and understanding, are you having any hormone symptoms now, so that we can address those now. If, there's situations where, we're starting perimenopause at 35, right? At 40, your periods might start getting off and your doctor may say, oh, well, you're in perimenopause. There's a lot that can be done that can actually start to regulate the cycle and get you ovulating again.
So as far as if talking about hormones, there's so many disruptors.
Mm-hmm.
What would you say are like the key things that women should be aware of as far as hormone disruptors, especially the estrogen? Every hormone, right?
Your skincare products.
I agree.
This
Yes.
is something. So we're sitting in the UK. You stand a much better chance here than you do if you're in the US, because they're not as regulated in the same way.
True.
What drives me nuts is how doctors will say, well, the dose makes the poison. And the studies show that, like, this is safe. And it's like, okay, this single product and the dose that's in it may be considered safe, right? Even though we know it's associated with all these problems. And genetically speaking, we don't know how problematic it is for you. But what nobody has assessed is when we use 13 plus products a day, and we do that for 30 years, nobody has assessed that. And so if you wouldn't put it in your mouth, don't put it on your skin. And that's a big place that gets us. And I know there's people that are like, but I'd like to have my nails done, or what about this? My blush, but I love it. And it's like, listen,
There's options out there.
there are options.
Yeah.
There are lots of options, but it is something that, one, if it's just one thing and everything else has been cleaned up, maybe it's not a problem. But if you are thinking about, okay, I'm gonna create a future, like, being in this species, like, give them the best foot forward. And if you can just take a break off of those things, and this is the thing with my patients, they'll take a break off of it, and like, just take a break. Let's get your baby body ready. And then you can always go back to, like, using some of those products if you absolutely love them. They find things they love more, but they also find that, like, wow, like, all of the other things I've been doing are having such a bigger impact. Like, I'm feeling so much better. Yes, because when you got that junk out of the way, you allowed your body to function as it should.
Yeah, and reducing that inflammation, which is key, because if your body's fighting off something, then it's going to be like somewhat attacking one thing while you're trying to create a healthy atmosphere. It's virtually impossible. So
Absolutely.
so valuable. Oh my gosh, I think there's so much we could go much more deeper, and I hope to have a deeper conversation about this, because I think every woman wants to know about, because what's the percent actually that women are miscarrying these days?
So it really depends on age. And so if we talk about because there's estimates about like a third of pregnancies end in miscarriage. However, because miscarriage can happen before implantation, so basically a chemical pregnancy, or you don't even know you're pregnant. So maybe implantation happened, but because of no fault of your own, chromosomes didn't divide the way they were supposed to, you actually lose that pregnancy, and you're like, oh, well, I was about 5 days late on my period, and you have no idea. So those estimates are more like 50%. So it might be half.
Yeah, there's so much to go into this, and I definitely want to go a lot deeper with you. So thank you, Dr. Jolene Brighten, for this conversation and all the work you're doing. I mean, obviously, you're helping so many women, and I know it's a topic that everybody wants to know more about, especially these days, because I think as we were talking about the hormone disruptors, it's a real thing these days. And luckily we're in a biohacking conference. So this is all about how to rid yourself of those disruptors and maximize our health. So thank you so much for everything
Yeah,
you're doing. This is such an honor.